that you're here and taking time out of your day for us. All right, everybody ready? Okay.
Alright, so like she said, my name is Megan, last name is McGreevy. So I am a ER physician at Good Shepherd. I've been there about 5 years. This summer I'll make 5 years. I'm originally from Kansas, and I've been here in Longview for about 5 years. So I started right when I moved here. I guess kind of my story, I'll just walk you guys through how I ended up where I am in terms of academics. I was very interested in medicine, probably in, I'd say, middle school. I had a bunch of orthopedic injuries. I broke my arm playing basketball and broke my elbow doing gymnastics, and so I was exposed to a lot of orthopedic stuff early on, and was interested in medicine. I always enjoyed math and science at school, and was pretty involved in athletics, so that seemed like a good fit. I went on to high school and kind of thought I would switch to engineering, so I was more leaning towards all the math stuff over science. So I took a lot of calculus and AP math courses, still heavy on the science, but more math. I was dating someone who was going to be an engineer, so I thought I would be an engineer too. Seemed like a good plan. So I followed him off to college and enrolled in all the same classes he was in. And of course we broke up after a few months, and I decided I didn't really want to be an engineer after all. So fortunately, a lot of that stuff transferred over to the pre-med program. I went to Kansas State, so I'm from Kansas. So while at Kansas State, I ran track. So I ran the mile and the half mile there, and then I was pretty involved in my sorority and took advantage of a pretty healthy, or not really healthy, Greek lifestyle. So, spread myself pretty thin, probably made some decisions I shouldn't have in terms of going out on school nights and, drinking too much alcohol and doing all those things that people make mistakes doing in college. But still focus on academics. So I graduated in 4 years with a degree in nutritional science, which was actually a pre-med degree. And I did pretty well in school. I think I ended up graduating with a 3.6. But again, I think some of my extracurricular activities probably hurt my studies a little bit. Just, being transparent with y'all. So I ended up taking a year off after college. So I applied to medical school. You apply about a year before. So beginning of my senior year of college, and I got waitlisted. And so I didn't get in my first go around. So I took a year off and I worked at a family practice office as a medical assistant. Tried to kind of increase my application strength. And then I studied for the MCAT. The MCAT is the big test that you take to get into med school. Got a better score, had that real world experience, did some volunteering, that sort of thing, and then reapplied and got in the second year. So then I went to med school in Kansas City. So med school is a 4-year program. Most programs you do, the first 2 years is in the classroom, and then the second 2 years you do clinicals. And so you rotate through all the different specialties, and some are requirements, some are electives. So through med school, I thought I wanted to do orthopedics, which is bones and muscles and joints. And that was kind of my track all through my third year. I went on a bunch of elective rotations and found out it wasn't really what I thought it would be. And I had kind of put all my eggs into one basket because I was so sure that's what I wanted to do before I really did it. And then came across emergency medicine, which I found I actually really enjoyed. And so it was kind of one of those things where I had to swallow my pride, because I'd been saying saying for the last, 10 years I was going to be an orthopedic surgeon when I grew up, but then I realized my heart really wasn't in it. So very glad I made that decision, and ended up, they call it matching, so you match into a residency program. So you do, give or take 4 years of undergrad, and then 4 years of college, 4 years of med school, and then you start residency. So I moved to Detroit, so I went from Kansas City to Detroit for 4 years to do a residency in emergency medicine.
The residency is 4 years?
Yes. So it depends on what kind of medicine you're going to practice, how long your residency is. So the shortest residencies, okay, this all may change by the time y'all get there, but as of right now, the shortest is 3 years, and then the longest is about 7. So just kind of depending on all the different specialties have different lengths of training. So emergency medicine was 4 years. So I lived in Detroit, Michigan for 4 years, and residency is tough. Can't practice, you can't be a practicing physician without it, but it's 80-hour work weeks. Well, that's as much as you're allowed to report you work. A lot of times you work more than that. So it's hard.
So you're like the low man on the totem pole, and okay.
You are. But that's where you learn. And so you're at a teaching hospital with lots of different specialists, and it's not exactly what you see on TV. You watch all the medical dramas, and they have the...
Yeah, I was thinking Grey's Anatomy.
It's probably not as glorious as that, and that's not very accurate. But you are the low man on the totem pole, and you work your way up, and you have more patient responsibility, and you're a doctor from day one, but you have supervising physicians with you the whole time. So you are gradually given more responsibility and freedom to make decisions on your own, but you're not practicing independently until you finish residency. So I finished residency in 2014, and then I had my daughter. So I got married my last year of residency, and then I had my daughter 2 weeks after I finished residency. Kind of squeezed that in there. And then we moved here. So she was born here, and then I started work about 6 weeks later. So I have been at Good Shepherd since August of 2014. So my group actually staffs all the different Good Shepherd locations, and so I work at the North Park campus, in Marshall, in Kilgore, and at the main campus on 80 and 4th Street.
In the ER?
In the ER.
Okay.
So my specialty is emergency medicine. So I frequently get the question of, so what kind of doctor are you going to be? So I am a emergency medicine physician. That's my specialty. And so that's what I will always do. To go back, so say I wanted to be a radiologist or some other type of doctor, you would actually have to go back and repeat residency. So that's one big difference I would say between, if any of you are interested in becoming a PA or a physician's assistant or a nurse practitioner. As of right now, they are not required to do residencies, and so they have a lot more flexibility. They can switch between different types of medicine because in most cases they're practicing underneath a physician and they get on-the-job training. But as a physician, you can't. There are a few people, like I could go work urgent care. I could work in urgent care because that's a similar type of medicine. But I couldn't go be a dermatologist, or I shouldn't go be a dermatologist because I don't have the training and that wouldn't be right for patient care.
Seems like it would be difficult because you're not specializing in one thing that you see over and over. As an ER doctor, your days are never the same.
Which is exactly what I love about it.
Okay.
So, going through medical school, I knew I didn't like being in the clinic. Like, I didn't like having a list of patients that I knew were coming in to see me every day. I felt like that was, I just dreaded having that list, and I didn't having a set schedule, and so I knew I wanted something that was a little bit more random. So I really enjoy walking into work not knowing what's going to show up. And so within the same hour, I will take care of a 4-year-old with an ear infection and a gunshot wound to the chest. You know, and someone whose water just broke and needs to deliver, and someone who just needs a work note. I mean, so it's that, you know, wide of a spectrum of what we see. And I have a lot of knowledge about a lot of things, but I don't have specialty knowledge about one area. So, you know, if you want to know as much as there is to know about head and neck cancer, then you should specialize in that. If you like the challenge of knowing a lot about a lot, but still needing a specialist a lot of times, this is a good career. There are certainly lots of cases where the adrenaline is rushing and it's exciting and it's just like it is on TV and it's the high trauma and the crazy, but it's not like that all the time. There are certain hospitals, like if you work in downtown Chicago or downtown Detroit, it's, you know, they call it the gun and knife club. So you do get that, but most jobs are a mix of all those different types of things. You know, as far as schedule goes, emergency medicine, you have a pretty atypical schedule, because we are open every hour, every day of every year. And so there's people that have to cover all those shifts. So in a given month, I work 50% of the weekends. So I work, you know, 2 out of the 4 weekends a month. And I work a combination of days, late afternoons, and overnights. And so it's kind of an unpredictable schedule. So if you're someone that likes a lot of structure, it might not be the best career.
So we had a nurse yesterday that said in the hospital they usually get to make their schedule and they do 3 12-hour shifts. How does that compare to what kind of schedule you will have?
So I can only speak to the experience I've had, and there are obviously different ER groups with different ER schedules across the country. But as far as the jobs I've had, that's not the case. We do have some people that do dedicated nights, like they only work the night shift. And their schedule is always nights, but for most of us, we don't work 3/12s or 4/12s like the nurses do. They have a very rotating schedule. They'll do 5 on and 2 off, and then 2 on and 5 off. Most ER jobs don't work quite like that. So I end up with a lot of days off in the middle of the week, which is nice because I can do stuff like this, or, you know, go to Target or Walmart on a Wednesday when everybody else is at work. You know, buying cheaper plane tickets because I have a bunch of days off in the middle of the week. But then I also work weekends. I also work holidays, you know, because everybody else is closed. But on the flip side of that, you know, patients and families are very appreciative because they know, you know, I'm giving up time with my family and my personal life to take care of them. So for the most part, people are very gracious when they seek care over, especially those times of the year. I think emergency medicine is awesome because when I'm not at work, I'm not at work. Like, I don't take call, I don't have a pager, I don't bring any work home, you know, and so in terms of family life, when I'm off work, I'm off work. And I can leave town, I can leave the country, and I don't have any responsibility. Whereas if you have a practice, that's something you have to consider.
It seems like you would see a patient in the ER and then they're gone, versus a doctor that sees them every year or every time they're ill, or even in the hospital repeatedly. I would think that would have good and bad. Maybe like you can let it go, but then you probably sometimes wonder whatever happened to that little girl that you.
Right. And so there's not a lot of continuity of care. And so if you find that you like to develop those ongoing relationships with people, it might not be the career for you. If you like that, you know, treat them when they're in front of you and then move on to the next patient, you know, it's a good choice. And so it's definitely a different, you know, some people in pediatrics, they enjoy watching the kids grow up. You know, they saw them at birth and now they're 18. That's not the case in ER medicine. You often don't know what happens to people, and you involved in their life at a very tragic time sometimes, and then you don't know the outcome, and so sometimes that's hard. See what else? It's also a nice career if you want to be very mobile. Like if you want to be able to move around a lot, it's an excellent career choice. It's probably one of the very few that you can pack up and move really easily. Like I could give my notice at work and pack up and move and start a whole new job in Colorado without any trouble because I don't have to recruit my own practice. You know, where a lot of the physicians that have their own practice, it takes 2 to 5 years to build up a practice of patients.
Okay. So you're gonna have patients, wherever, because people are having emergencies.
Oh yeah, there's no shortage of patients. There's too many patients, really. As far as, I guess, like income, there's different jobs. Some jobs you get paid per hour, some jobs you get paid based on how busy you are. But it's probably more of a guaranteed income versus trying to build a practice that might be more unpredictable. So that's kind of nice.
Tell us about earning potential for someone that has followed your career path. Like, what is a range?
For a ER physician? It's somewhat dependent upon what part of the country you live in. So probably like other jobs, there's a big variety between, Southwest and the Northeast. And it depends on how many hours you work. But I would say anywhere from probably 250 to 400, depending on where you
So
are.
12 years of college, or sounds probably dreadful to a lot of you right now. I know y'all are burnt out in school, but we've talked about a short-term program can give you great potential from just entering a low-level job. Then a 4-year degree could add on to that, and so that's a lot of money, but it's a lot of investment. But what was that video we watched that said everything, when you do things that are hard now, it will make your life easier later. If you take the easy road now, your life will be harder later. So
I think something also to consider is the debt that you will incur. It's kind of not wonderful to talk about. And again, things may change, by the time any of you would be at this point. But like, I graduated with $330,000 of debt. So at the age of 26, I was $330,000 of debt. So I actually got an MBA as well during med school. So my med school had a dual degree program, so that was a little bit of the debt. So I was able to get my master's in business with the emphasis in like healthcare at the same time. But I think the average debt for most students graduating now is probably between $250,000 and $300,000.
I know I had nothing near that, just from my parents, didn't have any money put up for college for me, and I did get some student aid. I can't remember how much I graduated with, but it was like $20,000, something like that, just for my teaching. And I know it's very hard to pay because the interest keeps, when you start working in the beginning, especially like teaching, you're not making very much money. I know I was still under the poverty level as a single mom several years into teaching. And so that, like she said, that's something to consider. How much money are you gonna owe when you come out?
So during residency, you get paid. Again, you're working your 80-hour work weeks. And when I was in residency, I made about, I'd say between $45,000 and $50,000 a year, which if you do the math per hour is not very good. So it's very difficult to pay any of your debt during that time because there's not a lot of money left after, living and rent and all that kind of stuff. routes to get through med school. Some people do the armed services, the military, and I did not personally do that, but there's a handful of people that will do the military, and I can't really speak to all the specifics of that, but there's a couple doctors in my group that did. If anybody has specific questions on kind of how that works, I know that you owe X number of years after you're done, but that they pay for your entire schooling. So if the military is something you're interested in anyways.
We have one, that's going in May.
Oh, yeah.
Oh, and Andy, that's right.
So
Andy, when are you going? June?
Yeah.
I'm so proud.
So we actually have one doctor in our group that's retired from the Air Force. So he did 20 years with the Air Force and then went back to med school. So he's older, so.
Tell us how you said you had a child. How has your work schedule and your career worked with your family life?
So, as a female physician, so one of the things I really like about emergency medicine is that there's a lot of women. So, not all fields of medicine are perhaps as 50-50 in terms of men and women. It's getting a lot better. But emergency medicine is definitely one of the better ones, I would say, in terms of a good, split between men and women. So my group especially, there's a lot of women. Most of us have children. Again, I think emergency medicine is nice because when I'm off work and I can be mom. And I don't have to split my time with taking phone calls at home and doing charts at home and that sort of thing. And again, I can take as much time off from work as I need to, and the practice wouldn't stop. I think that would be a lot harder if you were in a private practice. I'm not gonna lie and say it's easy.
Go ahead.
There were a lot of people who had kids during med school and during residency, and people made it work. So it's really whatever the best time is for you and your family. So I just have one daughter, so.
Is she in Longview schools?
So she's 4.
Okay.
So we're still in pre-K. So we're not there yet. So I actually had, her father is deceased, and so it's just her and I at home. And so I actually had a live-in nanny for the first 2 years, something called an au pair, which is just a full-time live-in nanny. That was kind of the only way I could make it work, working nights and weekends and holidays, and I'm not from here, so I didn't actually have any family here, or I still don't.
Yeah, I
So
think that would be
sometimes-
difficult.
Sometimes you have to get creative with childcare. So now I have, my nanny doesn't live in, but I basically employ a full-time nanny who has to basically mirror my schedule. So that's part of, when I hired her, she's great. I mean, so she has to be available for all the weird hours that I work. So like yesterday I worked, well, actually 2 days ago, I worked from 5 p.m. to 3 a.m. And then this weekend I'll work from 6 a.m. to 4 p.m. all weekend, and the next week I'll flip to nights. And so you have to be able to kind of flip back and forth.
So I'm sure you see all kinds of things in the ER. Are there times that's difficult when you get home to kind of?
Yes, yeah, and I think having a good support system of friends, and so all my colleagues, we kind of talk about cases, and some people have spouses that they can talk to about things. My 4-year-old is not so good at talking about that stuff, but I think you definitely have to have a way to deal with what you see. We see a lot of sadness, a lot of tragedy, a lot of stuff that you say, this is not fair. The 30-year-old mom that has metastatic breast cancer that, is on hospice because everything's failed. And the pediatric parents have co-slept with them and they rolled over on them and they suffocated in their sleep, you know, and so it's horrible, you know, and you see the car wrecks and the death and, but sometimes you can also help and save those people and bring them back. So that's really, really rewarding. You can't save everyone, but we do try to save a good number of them. So I think you kind of build up a little bit of a wall, and you have to, you know, you can't be a basket case on your shift. You know, you have to still be able to think rationally and think clearly. But yeah, it's definitely can be very emotional and draining, exhausting.
Do you guys have questions? Jamil?
So what's the most emotional thing you've ever seen in the ER?
One more time?
What's the most emotional thing you've ever
Or
seen?
the most emotional thing I've ever seen? I think I've had a couple of kids that have died, and then just having to watch their parents say, you know, it wasn't supposed to go like this. You know, I'm not supposed to be burying my child. You know, they were fine when I dropped them off at preschool, and now they're a lifeless body. That's really hard, because it's hard. It's, you know, sometimes when you have older patients that pass away, it's easy to say they had a good life, they lived, they loved, you know, but when it's a 2 and a 3 and a 4-year-old, and cases of like abuse, you know, those cases are really hard. You know, sexual abuse, we unfortunately see kids that have been sexually abused. That's really hard. A lot of anger that comes out of that, or kids that have been, you know, assaulted and come in and now have brain bleed and they're unresponsive and they'll never be the child they once were. Or seeing, you know, the drunk driver that killed a family. And sometimes I'll have to take care of the drunk driver at the same time as trying to save the family that they just killed.
Yeah.
So that can be difficult to stay neutral, you know, because I took an oath to do no harm. So I still have to provide care. So sometimes that can be emotionally exhausting because you want to not do that, but that's challenging.
Is there anyone in here that is interested in going into some sort of medical field? Teresa? Good, good. No. Yes, you are good.
And I think shadowing, there's lots of positions that will let you come shadow. Getting exposure early to the different types of medicine. And even if you think, you know, you want to do a radiology, you know, go shadow 5 different radiologists, because their personality can have a big impact on if you like the specialty or not. You know, you could do some wonderful person, you know, and it could sway you towards that specialty, or some jerk that can totally discourage you from that specialty. So don't let one person's, you know, behavior or opinion lead you towards or keep you away from a you know, specialty.
So do you enjoy, like, would you say you're like an adrenaline junkie? Like, do you like the fast, like, kind of emergency situations?
I like trauma. I like high adrenaline situations. I do pretty well staying calm in them. Like, I don't panic or freak out very easily. I also like the mystery behind it. You know, you get a person who comes in that they can't talk to you, they can't tell you what's wrong, and you have to basically solve the puzzle to figure out what's wrong with them. So I like that challenge of trying to put it all back together.
What would you say are your favorite type scenarios? Like, you'd be like, oh, I had a good day today. I had 3 people that came in with this, and only, you know, what's like your favorite thing to deal with and your least favorite?
I would say drunk people are my least favorite. Yeah, we get
It's
a lot
understandable.
we actually have a really big problem with methamphetamine. I'm sure y'all know that here. And so we get a lot of patients on meth in the ER, which are very difficult to take care of because they're very irrational, as you may imagine.
Yeah.
They're very distracting. So that's probably my least favorite is
People under the influence that you're not dealing with a normal human.
Yeah, so but that's part of it. I mean, that's not a big part, but part of my job is dealing with all walks of life and all types of things. I really like people that have kind of like whole body infections. We call it sepsis. Like they're sick from something and their whole body is kind of shutting down. I enjoy trying to resuscitate people. Like they come in and their heart stopped and you try to get their heart to start again, and you do CPR and you put them on a ventilator and put tubes and lines everywhere. I think that's fun. Blood obviously doesn't bother me at all. I think if blood bothers you, you can get over that. There was a guy who, our very first hour of our first day of med school, we were watching like a safety video on like needle safety or something, and he passed out, like fell out of his chair. You know, and this is this class of 250 med students, and so I mean, everybody gave him a hard time about it, but he went on and was a doctor and did just fine. So don't let the I don't like blood.
You can get over it.
You can get over it. But I don't mind that kind of. It doesn't seem gory or gross to me. It seems interesting and exciting.
So do you think that becoming a doctor is for people that are just like supernaturally smart, or do you think it's more about perseverance or dedication? I mean, I always kind of, until I went to college and I, got my master's, I thought college was for just really exceptional people, and really after being there and the fact I got through it, that I realized like it really isn't. Like I really truly believe everyone can do it if you will just go, stick with it. If you fail something, if you hit a roadblock, find a way around it. But I mean, medical school definitely would be, I would think, on a different level. How to kind of speak about that?
So I think you have to want to do it. I think you have to have the drive to do it. It's a long road. I mean, at the shortest, it's 11 years. Mm-hmm. So if you're doing it for a good income, it's a terrible idea, because there's a lot of jobs that you could make just as much money, if not more, without incurring all the debt, with a lot better hours. So don't do it for the money. You have to do it because you truly want to help people, or you see a need in some capacity of serving people and taking care of them. The joke is always, what do you call the person who graduates at the bottom of your med school class? Like, doctor, right? So, I mean, just like in your class, there's going to be somebody at the top and somebody at the bottom, but you're all going to finish your AP English class. And so, I wouldn't let that discourage you. I would not ever sit here and say, I'm not smart enough, I can't do it. You absolutely can. I think med school is hard because of the amount of information. They talk about being like a fire hydrant. Like the amount of medicine you have to learn is hard. And so you have to have, I think, the desire and the drive to want to learn it. And if you do, you can. I think just being really smart alone, I'm sure there are people that get through med school that are just really smart and they just happen to know it all, but I don't think that's the majority of people.
Questions, guys?
Yeah, you talked about how you get a lot of meth, like people.
Mm-hmm.
What about what's something you see like in teenagers? Like, is it just mostly like skateboard accidents, or like are kids like actually overdosing out here? What is it?
We see a lot of car accidents,
Oh,
a lot of distracted driving. Yeah, so we see a lot of teen car accidents. I would say that there's more meth abuse in the early 20s, mid-20s than actually high school. We get the occasional drunk high school kid. But fortunately we don't lot of substance abuse at the high school age. We see a little bit, but not a ton.
You see quite a bit of sports injuries from kids.
A lot of football related, basketball type stuff. You know, some shoulder dislocations, hip dislocations. You know, that's my job, is to reduce them and put them back in the joint. And so that's kind of cool. A lot of broken bones that we get to push on and reset. You get to hear all that crunch, crunch, crunch of the bones. I enjoy that. I think that's neat. I like doing procedures, so I like, you know, if there's something I can fix, I like fixing it. But yeah, we don't, you know, I wouldn't say we see a ton of high school kids. We see a lot of little kids, a lot of really old people, and a few in between. So it's definitely kind of, I would say, skewed towards the ends of the age groups. You know, I personally like working in more of the community hospital setting. Even within hospitals, there's sometimes a difference in your patient population depending on where you work. Some hospitals are known for seeing more insured patients. I personally like working in more of the community setting where people have like less resources. I find that more rewarding. A lot of uninsured, underinsured, you know, maybe lower socioeconomic status. There's some places that are a little bit more like concierge medicine. It's a little bit more wine and dine. I don't really enjoy that kind of medicine. I like just taking care of people regardless of your ability to pay and who you are.
Do you have frequent visitors that?
We call them frequent flyers.
Okay, explain that.
Yeah, well, every ER has frequent flyers, and they're sometimes it's patients that have no other access to care. You know, we're it. If you don't have insurance, it's really hard to see a doctor, unfortunately, in this country. You know, and we see a lot of patients who maybe can't qualify for, say, Medicaid, but they don't have insurance through their job. They make just enough that they kind of fall through, and so we're it. We're all they can see. So sometimes those become frequent flyers. And then there's some patients that I think maybe are just lonely and they come and see us all the time. And people with just chronic health conditions that they're sick all the time, and so they come and see us. Yeah, I think every ER across the country probably has their share of. So there is some continuity of care. I don't think it's supposed to be like that, but we get that continuity of care of patients that, oh, so-and-so's back. Or
What about the people that just come in there and put in drugs? Like they just want.
yeah, so we do have a population of drug-seeking patients, and that's really hard, because part of my job is to basically judge whether your pain is real or not, which is hard. You know, maybe something you were speaking about earlier, one of the things that's hard is, you know, I try not to judge people, but you have to be judicious in your giving of pain medicine, because there is such a epidemic of substance abuse that you unfortunately get patients that come in that are just seeking narcotics, and so they will, you know, I'm not saying all their pain is fake, but some. And it really hurts the patients that are in true pain. Like, as a country, we're prescribing less opiates now, and we have different laws and restrictions on the prescriptions we can write. So like in Texas, we have to have a special prescription pad to write for like Vicodin or Norco or Percocet, which we didn't used to have. And so most physicians around here just won't prescribe that. And so you end up with a lot of patients with true chronic pain. You know, they have cancer that has eaten away at their bones, or they have a terrible orthopedic injury that it's hard to control their pain now because we have such strict rules, because there were so many people that were abusing it. But we unfortunately do get some drug-seeking patients, and we have different, you know, databases and things that we try to track people in. Like, I can pull up your name and your birthday and see every controlled substance prescription that you've had filled. So not for your blood pressure medicine or antibiotics or that sort of thing, but for like controlled narcotic pain medicines, there's a database that we're encouraged to use, use, you know, to make sure people aren't going around and just getting drugs and selling them.
Like ER to ER or something.
Yeah, so
That's
ER
good.
shopping, doctor shopping type stuff. Yeah.
Good question. What else? Not every day you get to talk to a doctor for this long. What else do y'all want to know?
How do you handle the patients that are like yelling at you?
So you say calm. For a second you say calm and don't yell back. I think you just try to stay respectful and you hold your ground. You know, in the back of my head I want to say things like, this is not Burger King, it's not have it your way. Which is hard because there's kind of this push for like customer satisfaction, just like in any industry, whether you're working at Verizon or in the ER, there's this push for customer satisfaction, and so it's a really fine line of, again, I take this oath to do no harm, and so I'm not going to give you a prescription or do a test that I think is harmful for you. And that's with, you know, my 12 years of medical school knowledge. And so you have these patients that went on Dr. Google and they know better than you. And so that can be really challenging to stand your ground. But yeah, I get yelled at, I get called names, I get insulted pretty often. So I think you have to have tough skin, and you have to you can't let it bother you because it will ruin your day. And then you'll be distracted for your next patient. Like, you have to be able to refocus, you know, so you don't miss something or hurt someone. I think something that's really challenging for me is patients often don't think I look like a doctor. I get that a lot. You know, and obviously I work in a team of people. You know, there's respiratory therapists and techs and nurses and doctors. But most of the time, I'm incorrectly assumed to be someone I'm not. And so I get a lot of patient complaints that I never saw a doctor. So, you know, my scrubs say doctor, my name tag says doctor, I introduce myself as doctor, but, so I think that there's still a
What do
little
a
bit
doctor
of,
look like? What they mean?
What is it?
Like,
Right, what is it
like,
supposed
what
to
is
mean?
it?
everyone thinks I'm their nurse. Which, you know, is fine, because we need good nurses too. But yeah, sometimes patients will write in complaints that they didn't see a doctor. So, you know, I think that there's still some stereotypes that need to be overcome, kind of, in the health setting. So, again, I think you have to have tough skin, and it's annoying, and it's silly, but you can't let it bother you. Like, you can't let it, I don't take it personally offensive, you know. I'm there to be part of the medical team, to work with everyone, to get the job done, but that happens a lot.
Can't be thrown off track for your other patients. I mean, that's a good point.
Yeah, I have a lot of people who tell me, oh, you're too young to be a doctor, you look too young. You know, and sometimes you want to come back with something snarky, but you don't, because that would not be professional.
And then
So-
they'll blast on social
Yeah.
media.
So you say smile and say, oh, thank you. You know, so I think people just want to feel confident in how you're taking care of them, and a lot of it's just how professional you are. So, you know, I think just you have to stay professional no matter who's yelling at you or who's trying to belittle you or whatever they're calling you or not calling you. And I think you learn that with maturity. I think one of the hardest things to learn is how to tell someone that their loved one has passed away. You know, I think that was one of the first times I remember crying in residency, was having to tell that first person whose family member died. I think that that's something that we do on a, not daily basis, but unfortunately often basis, is you have to have that empathy and that compassion to be able to tell someone that their loved one has passed. And it's hard because I have such a brief encounter with this person, and I give them news that's gonna change the rest of their life. And so that's kind of a weird place to be, is that I'm the deliverer of this horrible news, and then I'm gonna go see the patient in room 14 who is irritated that they've had to wait an hour because you were trying to resuscitate someone. So that's, challenging.
It seems like that it would be difficult to leave from work from a situation like that or a day like that, and then you're meeting your friends for, a wedding shower or a baby shower, for dinner, and they're all, oh, hey, how was your day? And you don't want to just, and I'm sure patient privacy, you can't share a lot, and no one has a clue what all you went through, but now you've got to flip the switch. Do you do anything outside of work that helps you with like stress?
Sure. Over the last lots of years, I've done different things, whether it's running or yoga or music. I listen to music a lot, different types of music, and so that's kind of a good way to let down. I think in your mind you have to kind of build a compartment wall, and not to sound unsympathetic or cold, but you kind of have to learn to leave it at work, because otherwise I think it will impair your ability to be a good physician. It will eat away at you personally, and so you really do have to leave it at work. There's those few cases that you bring home with you and you can't let go, the sexual assault or that kind of stuff, but you do have to compartmentalize and leave it at work. I have a little girl that I come home to, and I can't bring that baggage home to her.
Christian, did you have another question?
Yeah, you went to school in Kansas, but you work here. Was there a residency like nationwide, or did you have to do extra steps?
So medicine is nationwide. So there's lots of other jobs, law, I don't know about teaching, but you have to have a state license with a state test. So I have a Texas medical license, but I didn't have to take a Texas medical test. So your board exams, so you take a series of board exams through med school and residency, that's a national certification, and then you just have to have a state license.
And that's just like an application
And
process?
Yeah, you have to submit a bunch of, documents and pay a bunch of money, and then they give it to you. But there's no special test. But I think that's somewhat unique to medicine. A lot of other fields, I know like pharmacy and things, you have to actually take a different test per state. So yeah, so I was able to go from Kansas City to Detroit to Texas, and I just had to apply for my state license each time, but I didn't have to take an additional test per state.
So do you plan to stay in Texas, or?
So I do. I almost moved home about a year ago, but then I decided I like it here. So I like Longview. I really like my job. I think it's a good place to raise my daughter, and for the foreseeable future, yeah.
Okay.
Which I know might be hard for some of you to hear because you've been here for a long time and you've never seen anything else, but I think getting out and spreading your wings, and I've obviously lived lots of places, and I would encourage you to get out and go and see and do. And
How did you find out about Longview?
Yeah, why do you?
So I hate the cold weather. I hate cold weather, and so Detroit is very, very cold. It's pretty much in Canada. And so one of my attendings, so in residency you call them attendings, those are your supervising physicians, randomly got a flyer for this job. They were looking for someone. Have no idea why. And so they gave it to me because they knew I wanted to live in Texas. Texas is a pretty physician-friendly state. We have good tort reform laws here in terms of medical malpractice. The lawsuit caps and things are better here, and so it's a good place to practice, and it's warm. So I just randomly called them and got on a plane and came down and interviewed, and I liked it, and I said, I think it's a good job. I really liked the people. My group of doctors that I work with is awesome. They're great people. I looked at jobs in Dallas and a few other places, and this just felt like home. It felt like a community of people, a more close-knit community versus a bigger city. Detroit and Kansas City were obviously a lot bigger than Longview. And there are things that I miss from living in a bigger city. But I think on the day-to-day level, this is better.
All right. Do y'all have anything else? We've almost covered.
Okay, you know how you gotta tell the people like that somebody passed? Do they ever like try to blame it on the doctor?
Yes.
Like,
Yeah, sometimes. And again, kind of like I was saying earlier, you have to know that in that moment of grief, people say some pretty awful things. And if I know in my heart I gave it everything I had and I used every bit of knowledge that I had and I tried as hard as I could, then, you know, they're just reacting to a horrible, horrible news. But yeah, I mean, sometimes, I've fortunately never personally been sued. I get people who threaten me all the time, but I'm gonna get my attorney and I'm gonna sue you, and, you know, that's their right, and they can, but they have to be able to prove that I did something wrong. People do all sorts of things. They lay on the floor and they scream, they say nothing, you get that whole spectrum of, it's just that shock, especially if their loved one wasn't sick.
Yeah.
It's one thing if they knew they were sick, but it's these car wrecks and they talked to them 30 minutes ago and now they're gone. I think it definitely gives you a new appreciation for how fragile life is and how none of us are guaranteed any time. It's kind of morbid, but true.
Have you ever brought somebody back alive?
Yeah. Yeah, frequently patients come in and their heart stopped and we're doing CPR and we get them back. Doesn't happen as often as it does on TV. It does happen.
She said that was one of her favorite things to do.
Yeah. A lot of it obviously depends on how old you are, what caused you to, basically die in the first place.
Do you find that you have to help people outside of work? Like if there's an emergency situation, isn't there a good Samaritan?
Yeah, I've helped with a few things, on like an airplane or two, and at a triathlon I was at, somebody was having a seizure, and so I think, not to brag about ER doctors, but we're probably the one you want to know, because what happens when somebody dislocates their shoulder at the soccer game, or somebody's unresponsive on the plane, or somebody falls off the back of the bleachers? It's like, who are you gonna call? The ER doctor, because your cardiologist is gonna be great, but they're not gonna be able to help with the broken arm, and the pediatrician's great, but when someone's not breathing, they might not know what to do. They might have some knowledge, but we're really kind of like the jack of all trades. Yeah, and so it's very rewarding to be able to help in nearly any situation.
My son, we are frequent injured. I have two boys. We always have some type of injury, and I'm very thankful. Dr. Kelly at Hospitality, my son had busted his nose open. He was running on a wooden swing set, like a huge one, and looking back, and right when he turned, he caught something there level, and it was
Filleted open.
and then it swelled, and so it's just like this open gap. Everybody kept coming in and going, "Oh, that is bad." And I was really worried. You're thinking, "Oh, great, my child's gonna have this horrible scar right between his eyes for the rest of his life." And I kept, kind of questioning Dr. Kelly. Do you think we need to call, someone in, a plastic surgeon? And so he did it. And he said, follow up on Monday, make an appointment with this plastic surgeon. And we went in, and they said, the plastic surgeon said, "Who did the stitches?" And I told him, and he said, he doesn't need anything. He said he did exactly what I would have done. There's nothing here that I would do different, and it's healed. So, and that's, I'm just so thankful. That could have been, his face could have been, completely changed. And I was just really, so people are thankful for people like you. You may never hear it, but they remember.
you know, we don't do what we do to get thanks on a daily basis. I think you have to be internally motivated to want to help people. You can't wait for people to say thank you because they might not. Because again, they're at a, you know, an emergent time in their life where they're not thinking about that, and that's okay. They should, you know, I shouldn't. They have enough other things to think about. They don't need to think about thanking all of us. And sometimes people come back and, you know, will say thank you later, which is nice, but not expected.
Do y'all ever deal with like criminal investigations or anything like patients that are not?
Yeah, so unfortunately, sometimes we see the victims of criminal stuff. So like for sexual assault and stuff, we have a special policy and protocol that we follow to, like if someone was raped. You know, we get this special sexual assault nurse involved and they do like a rape kit and that kind of stuff. You know, and people that have been shot that are part of an ongoing criminal investigation and yeah. So we have law enforcement pretty often in the ER. We get a lot of like medical clearance for jail. You know, patient was pulled over for DUI or, you know, that sort of thing, and we have to clear them to say they're okay to go to jail.
They'd probably rather stay at the hospital.
Yeah, and that
Do they
happens.
really be handcuffed to the bed?
Huh?
Do they really be handcuffed to the bed?
Yeah. What is our family?
My mom, you know, does dialysis, and there are patients that are brought in from jail that will be in shackles,
Yeah.
and will have a guard sit
Oh, yeah.
next to them the whole time.
People that you're scared of going to the room with them.
And that's why they're handcuffed to the bed.
Yeah, but like either way, they're pretty still.
Yeah, I mean, if I'm really, when they're handcuffed to the bed, arms and legs, and there's an officer at the bedside, and, I've been spit on, and so
Oh, no,
sometimes
yeah.
Yeah.
I would think about it too.
Yeah, so like sometimes we'll put like a mask on the patient so they can't spit on people.
I think that's dumb. Like I'm trying to help you, and you know why you gonna
Yeah.
tell them, you know?
Yeah, people are not nice sometimes.
And sometimes mental illness, you know, you're dealing with,
Yeah,
and that's not like you walk in and you know that.
yeah. So, I've personally never been injured, but we've had doctors that have been assaulted, nurses that have been assaulted, punched. Yeah.
Have you ever seen it?
I was not there when that person got punched, but I've seen nurses from, yeah. I've seen full-on wrestling matches go down.
Wow.
Yeah, we have security in the ER and, stuff sometimes happens and it's kinda ugly sometimes.
Alright.
Yeah.
Like if you punch back, like
Yeah, you can't punch back.
I mean, like, punching
Yeah,
you,
we were trying to defend yourself.
I think you could probably use reasonable force to get someone off of you. You better not throw the first one.
Yeah.
Yeah.
Do y'all ever like check for victims that you like suspect have been sexually assaulted or just like have some sexual abuse going on? Like talk to them privately?
Yes, yeah. And so, so like human trafficking is something that we're watching for all the time. I frequently make up reasons for everyone else to have to leave the room, or I just tell them they have to leave the room, even for minors, just so I can talk to them alone. But yeah, that's something that we're always screening for. And there's a lot of, sensitive information you have to give patients, like when I have to tell someone they have HIV for the first time. That's hard.
Ooh.
That's another emotional abuse.
Jimmy will look up.
I've had to do that probably twice in the last month.
Wow.
they just cry.
Yeah, I bet that's hard. to tell somebody, yeah, you got AIDS. I'm sorry.
Yeah,
That's bad.
yeah, but it's something that's part of what we're always looking for.
Oh,
I couldn't do it. That breaks my heart trying to tell somebody.
Yeah, and it's, and because, in that one sentence, they feel like their whole life has changed. And there's a lot of great medications out now, and patients do much better than they ever did, but it's still a very serious thing. So, just like when I say you have cancer, they came in thinking they had a stomach bug, and they go home knowing that they have cancer that has eaten up their entire body.
Sounds like a difficult yet rewarding job.
It is, and I couldn't imagine doing anything else. I mean, for all the downsides and all the hardships, I mean, I couldn't imagine myself doing anything else.
So if you had to do it all again, you
I'd
would.
do it again.
Okay. Then that means it was meant to be, our speaker yesterday said, follow your heart,
Yeah.
you know. And this
And
is,
don't be afraid to change your mind. And don't be afraid to admit that you changed your mind. You know, don't do something just because you said you'd do it. Like, if it's not, you're allowed to change your mind. I mean, I followed a boyfriend in one field and realized that was a terrible idea. So, you know,
I've been telling them that too. I said, you don't have to divorce your college or divorce your career. You can change when you're ready. There's no, you know, stigma to that.
and even if it takes you 3 years longer to get there because you know, made some decisions you shouldn't have or you wish you wouldn't have, that's part of who you are, you know. Maybe I could have gotten here a year sooner, but maybe not. I mean, so don't let your past, you know, define your future. That cliche saying. True though.
All right. Class is going to soon end. Any other questions? Last chance.
Oh, no question. Was Longview the best opportunity?
I like the size of Longview. I like the people I work with. I like that I can get anywhere in 10 or 15 minutes. You know, I spent an hour commuting each way in Detroit and even in Kansas City. So just at the end of the day, like, I knew that the next chunk of my life was going to be dedicated to raising a little one. You know, and I don't really have time to go to all the concerts and the shows and all the stuff that I did before. You know, so on a day-to-day level, I like being able to get to her school and to my work in less than 10 or 15 minutes. I like running into people I know. You know, it was a good financial opportunity. It's a good way to get out of debt. You know, I think you kind of got to look at the whole picture. The weather was good, minus all the rain, but and it's not for everyone. I mean, you know, you may have been here your whole life and you want something different. I didn't want to move back to where I grew up. You know, so I think it's, you gotta kind of look at that picture for where you're going. And I also knew that going into emergency medicine, I wasn't tied to Longview. I could come here for a year, and if I didn't like it, I can pick up and leave. You know, obviously I have to give my job notice and that sort of thing, but I don't have to start over in terms of building a practice. I have that luxury. So I can try it, and if I don't like it, leave.
Have you paid off your debt?
Yes. Yeah, so I actually paid off my debt in 2 years. So a lot of us, you know, if they always say live like a resident, you know, if you're used to living on $45,000 and then you get a big raise, just keep living like a resident for a couple more years.
That was so smart.
Yeah, so I've been out there for a couple years.
I'm sure I would have bought like a new car and a new house instead. That's so good.
Yeah, so, I mean, the interest is crazy. I mean, the compounding interest on those loans. And so, you know, whatever you go into, whether it's teaching or medicine or anywhere in between, you know, get out of debt first. And then,
But also don't let the fact that you have to take a student loan keep you from going.
right.
I mean, you know, yes, it's a pain to pay it when you get out, but what's your, if you don't have another choice,
Yeah, and my,
don't not go.
there were kids whose parents, you know, were able to put them through college and med school. Mine weren't. You know, so I knew that I was going to incur that debt, but in a way I think that makes you work that much harder, because this is my debt. I've earned this. You know, my parents obviously set me up with a great, you know, upbringing to get me ready to do that, but financially it was my debt, my earnings, you know, I paid it off. So, and the loans are out there. I mean, they'll loan you plenty of money. It's not hard to get the money. Yeah, for good or bad, but.
All right. What do we say to Dr. McGreevy?
Thank you.
Thank you.